Have you ever paused to reflect on how your post-meal habits could be influencing your well-being? Daily, countless individuals across the nation, especially older adults, unwittingly partake in straightforward activities in the half-hour following a meal that may quietly jeopardize their well-being. These seemingly innocuous decisions may result in dire outcomes, including heart attacks, strokes, or even unexpected fatalities. With more than 50 years in the field, I've seen how seemingly minor choices, frequently ignored or undervalued, can lead to significant health challenges. In this video, I'm Dr. Robert Matthews, and I will guide you through 3 harmful habits to steer clear of after meals to protect your well-being and that of your family. Throughout the years, I have had the honor of caring for thousands of patients, including numerous otherwise healthy individuals in their 60s. It's heartbreaking to witness how a single poor decision made after a meal can lead to such devastating losses for some individuals. Just last week, 3 seniors lost their lives because of seemingly harmless habits they were unaware could be dangerous. However, there is a silver lining. Seize the opportunity to shape your destiny starting now. Stick around until the end of this video, and you'll discover not only what to steer clear of, but also 4 straightforward, doctor-recommended habits that can enhance your digestion, bolster your heart health, and potentially extend your lifespan. I will recount true stories to illustrate the importance of these tips, such as the tale of Michael, who nearly lost his life because of severe acid reflux, or Susan, who suffered a stroke after taking a hot bath. These narratives are common, yet they highlight the importance of making the right decisions in the crucial 30 minutes following a meal. You'll uncover 5 powerful eating strategies to ward off illness and enhance your overall well-being, enabling you to feel better each day. Don't allow unawareness to rob you of your well-being. Stay with me as we navigate through this video. This might just be the secret to a more joyful and vibrant life for you and your loved ones. Before we get started, make sure to subscribe and activate the notification bell so you won't miss any crucial health insights like these. Your encouragement is invaluable, and if you find this video useful, I would greatly appreciate it if you could like and share it with others who may also gain from it. If you're finding this video engaging, feel free to leave a 1 in the comments below. If you have any feedback, please don't hesitate to share a score of 0, as it will help me enhance my work and provide you with more valuable content moving forward. Now, let's dive into some enlightening insights. 1. Reclining immediately after a meal. It's a frequent practice. After relishing a delightful meal, you find yourself reflecting, "I'm quite full, perhaps a brief rest is in order." However, that seemingly harmless choice can lead to significant repercussions for your well-being. Reclining immediately after a meal may result in acid reflux, pneumonia, or potentially play a role in weight gain over time. These are risks that often go unnoticed, yet they are more prevalent than one might assume, particularly in the older population. Allow me to share the tale of one of my patients, Jack, a 62-year-old man. Every evening after dinner, Jack settled into his routine, reclining on the couch to unwind. One day, as he nestled into his familiar post-meal spot, an unexpected occurrence took place. Not long after he settled in, an unexpected wave of breathlessness washed over him. A heaviness settled in his chest, an undeniable pressure that demanded his attention. Fear gripped everyone as Jack was hurried to the hospital. Fortunately, he emerged from the harrowing experience, yet the physician's assessment uncovered a troubling revelation. Stomach acid had surged back into his airways, inflicting significant harm to his lungs. This scenario may seem intense, yet it is far from unique. I've observed numerous individuals facing comparable challenges stemming from this seemingly innocuous practice. Dr. Elizabeth, a respected gastroenterologist, explains that reclining immediately after a meal significantly increases the likelihood of stomach acid and undigested food returning to the esophagus. This condition is referred to as acid reflux. It may begin with heartburn or slight discomfort, but if the acid ascends to the airways, it can result in pneumonia. This poses a significant risk for older adults, as their esophageal muscles tend to be less robust, complicating their ability to retain food and acid. For older adults, this is not merely a small annoyance, it poses a significant danger that can result in severe health issues such as pneumonia. Understanding the body's diminishing ability to prevent reflux with age is crucial, making it vital to refrain from lying down after meals. Rather, consider taking a brief stroll, maintaining good posture, or participating in a soothing activity that facilitates the proper digestion of your meal. Minor adjustments such as these can greatly enhance your digestive well-being and avert issues in the future. 2. Indulging in a hot bath immediately after a satisfying meal is a ritual that many cherish as a delightful way to relax and rejuvenate. It's a widely accepted approach. After enjoying a delightful dinner, you immerse yourself in a warm, comforting bath, allowing the soothing waters to wash away the day's stresses. However, many individuals are unaware that immersing themselves in hot water right after a meal can interfere with blood circulation, potentially heightening the risk of a stroke or heart attack. This is an important aspect, particularly for older individuals, and it's an issue that many seniors may not recognize. Allow me to share a story about one of my patients, Sarah, who is 65 years of age. Every evening after dinner, Sarah embraced a soothing routine that brought her peace. She would indulge in a soothing hot bath to unwind before drifting off to sleep. As the sun dipped below the horizon, she completed her meal and fell into the familiar rhythm of her evening routine, a ritual she had embraced for years. She drew a warm bath and eased herself into the soothing water. Yet again, an unexpected twist unfolded. As she immersed herself in the warm water, an unexpected wave of weakness washed over her, causing her to crumple to the floor of the bathroom. Her son, present at home, hurried to her side just in time to summon an ambulance. Regrettably, Sarah experienced a stroke that resulted in partial paralysis affecting one side of her body. Upon Sarah's arrival at the hospital, a cardiologist took the time to elucidate to her family the risks associated with her habit. Following a meal, your body channels blood to the abdomen to facilitate the process of digestion. The doctor explained that when you immerse yourself in hot water, it prompts blood to surge towards the skin, consequently diminishing the blood flow to essential organs such as the brain and heart. This disruption in blood flow can lead to a stroke or heart attack, particularly in those with pre-existing health issues such as high blood pressure or diabetes. This risk extends beyond just hot baths. Regardless of the temperature of the water, bathing right after a meal can impose undue stress on your body and disrupt normal blood flow. For older adults, whose bodies are already managing slower metabolic and circulatory functions, this can pose a considerable health risk. For your own well-being, it's advisable to refrain from bathing immediately after eating. For those who truly enjoy unwinding in the bath, it's wise to wait a minimum of 30 minutes to let your body finish digesting and to stabilize your blood flow before you treat yourself to that calming soak. 3. Vigorous activity. Some individuals think that engaging in physical activity post-meal, such as ascending stairs or handling heavy items, may assist with digestion or potentially offset the calories just ingested. Although moderate physical activity plays a crucial role in maintaining overall health, diving into intense exercise right after a meal can place considerable stress on your heart and body. Many older adults often fall into this common error, unaware of the potential dangers it carries. Consider the situation of Robert, a 60-year-old individual under my care, who has consistently embraced an active lifestyle. Robert was convinced that taking brisk walks or tackling hills after meals would keep him fit and potentially enhance his digestion. However, one day, as he ascended the stairs to his apartment following a hearty meal, an unexpected event occurred. Upon arriving at the 4th floor, he was abruptly overwhelmed by intense chest pain. He fell onto the stairs, and emergency responders were swiftly summoned to the location. He was quickly taken to the hospital, where medical professionals found that he had experienced a heart attack, resulting in 30% of his heart muscle being irreparably damaged. A cardiologist who treated Robert explained that after eating, the heart is already working hard to maintain blood flow to the stomach and digestive organs. During vigorous physical exertion, like running, ascending stairs, or hoisting heavy items, you are essentially demanding more from your heart. The added pressure can significantly increase the likelihood of a stroke or heart attack, particularly for those with pre-existing conditions such as high blood pressure, heart disease, or diabetes. If you're still engaged with this video and appreciate these lessons, I'd love for you to comment one below to show me you're still with me. For individuals over 50 or those with certain health conditions, it is crucial to steer clear of vigorous exercise right after a meal. It is essential for the body to have adequate time to digest food thoroughly before participating in vigorous activities. Rather than diving into high-intensity exercise immediately after a meal, consider allowing a pause of at least 30 minutes before you begin. Engaging in light to moderate activities, such as a brief walk or some gentle stretching, is considerably safer and can offer benefits while avoiding undue strain on your heart. The half hour right after eating presents a remarkable chance for enhancing your well-being. However, like many aspects of existence, it is also a period when errors can be readily committed. Steering clear of risky behaviors is crucial, yet making the most of these 30 minutes can significantly enhance your digestion, bolster your heart health, ward off illness, and ultimately contribute to a healthier life each day. By implementing these minor yet impactful changes, you can pave the way for a long and satisfying existence. Drawing from my extensive experience in the medical field, here are 4 straightforward yet powerful habits you can start implementing today. Begin putting them into practice immediately following your next meal. A change will be evident. 1. Maintain an upright position with proper posture. Following a meal, the allure of reclining or sinking into the couch for some relaxation is hard to resist. Nevertheless, this position may obstruct digestion and result in unease. It's essential to maintain an upright position and embrace proper posture instead. Maintain a straight posture, keep your feet grounded on the floor, and take a moment to unwind for 30 minutes to facilitate proper digestion of your meal. One of my patients, Linda, 58 years old, had been struggling with stomach pain and heartburn for many years. She explored every possible treatment and medication, yet nothing appeared to yield results. Then, she chose to adopt a straightforward practice, maintaining an upright posture after her meals. The outcomes were extraordinary. Over the years, her stomach issues have shown remarkable improvement, allowing her to live comfortably for more than a decade without the need for any medication. Maintaining proper posture facilitates the seamless movement of food through the digestive system, helping to avert issues like acid reflux, bloating, and discomfort. This habit, though simple and frequently neglected, can significantly impact your digestive well-being. 2. Enjoy warm beverages 10 to 15 minutes following your meal. Once you've allowed your body some time to process, consider enjoying warm beverages such as lukewarm water, barley tea, or gentle ginger tea. Engaging in this activity roughly 10 to 15 minutes post-meal can provide relief to your digestive system and facilitate a more seamless process. Tom, a 63-year-old patient of mine, previously faced challenges with stomach burning and bloating. His unease frequently made him feel lethargic and exasperated. After adding a warm beverage to his post-meal routine, he started to feel lighter and observed a reduction in his stomach discomfort. His digestion not only got better, but he also found that his sleep improved and his appetite increased. Avoiding cold water, ice-cold beverages, or strong teas right after a meal is crucial. These may narrow the blood vessels in your stomach, potentially hindering the digestion process and resulting in discomfort. 3. Engage in serene dialogues with those dear to you. Following a meal, numerous individuals tend to drift into a state of distraction, whether it be through watching television, browsing their phones, or just enjoying a moment of quietude. Engaging in a relaxed and cheerful dialogue with those you care about can significantly benefit your well-being. Rather than allowing your thoughts to drift aimlessly, participating in calm, cheerful dialogues can alleviate stress and enhance your digestive health. Consider Susan, a 59-year-old patient of mine, who used to spend her post-meal hours watching TV in solitude. She frequently experienced a sense of fullness and tightness following her meals. However, after just a brief 15-minute conversation with her spouse following dinner, something remarkable unfolded. Her digestion became more effortless, and her overall sense of wellness flourished. The soothing dialogue allowed her to feel more at ease, providing a far more beneficial method to decompress than merely switching on the television. Engaging in cheerful dialogues enhances circulation, supports digestion, and reduces stress levels. Additionally, they play a role in supporting your heart health and may aid in preventing future stomach problems or even heart disease. 4. Enjoy a leisurely stroll for 10 to 15 minutes following a 30-minute session. It's important to steer clear of vigorous workouts immediately after a meal, but a leisurely stroll through your garden, around the neighborhood, or in a nearby park can greatly benefit your well-being. After giving your body around 30 minutes to digest, a gentle, leisurely walk for 10 to 15 minutes can enhance your digestion and support a healthy weight. David, a 61-year-old individual living with diabetes, made the choice to begin walking after dinner. For years, he battled high blood sugar, relying on medication to manage the condition. In just a few weeks of adding short 15-minute evening walks to his routine, David experienced significant improvements in his blood sugar levels, allowing him to cut his medication dosage by half. Soft activity following a meal can aid in balancing blood sugar, enhance circulation, and support proper digestion. Always keep in mind that the essential approach is to maintain a gradual and consistent pace. There's no requirement to overexert yourself. The proper approach to nutrition is essential for well-being and a long life. A common misconception is that consuming vast amounts of food equates to increased strength or better health. However, the reality is that the focus should be on the quality and manner of consumption rather than sheer quantity. This becomes particularly evident as we grow older. The way we eat, especially as we move past middle age, plays a crucial role in determining the health and vitality of our later years. The decisions we take at the dinner table today will influence our well-being in the days to come. Throughout my 50 years of practice, I have encountered numerous patients, many of whom faced challenges such as high blood pressure, heart disease, and acid reflux, all of which were closely tied to unhealthy eating habits. To enjoy a long and vibrant life, it's essential to adopt subtle shifts in your relationship with food. Discover 5 straightforward and impactful eating strategies that can enhance digestion, ward off illness, and enable you to savor your meals while promoting your well-being. 1. Avoid excessive eating. Cease filling at 80% capacity. With the passage of time, our metabolism tends to decelerate, leading to a decrease in the efficiency of digestion. A common oversight I observe in my patients is maintaining the same eating habits they had in their youth. This creates undue pressure on the stomach, resulting in bloating, fatigue, acid reflux, and potentially elevated blood pressure. Consider the situation of one of my patients, David, who is 64 years old. He was consistently a robust eater, convinced that the greater his consumption, the mightier he would grow. One fateful day, following a hearty meal, he was suddenly struck by intense chest pain and swiftly transported to the hospital. Medical professionals found that his stomach had grown to such an extent that it was exerting pressure on his heart, leading to considerable discomfort. The physician's guidance was unmistakable. Experiencing bloating or drowsiness post-meal is your body's way of signaling that you've indulged a bit too much. Pause before reaching your limit. Simply consume food until you feel content. This straightforward adjustment empowered David to manage his well-being and avert additional complications. 2. Manage portions using your hands. A simple method to regulate portion sizes is by utilizing your hands as a reference. For instance, a single serving of rice should comfortably nestle in a lightly clenched fist, while vegetables and fruits ought to occupy half of your plate. As for protein sources like fish, meat, or eggs, they should be proportionate to the size of your palm. This approach helps maintain portion control effortlessly, eliminating the need for calorie counting or precise measurements. Thoroughly chewing each bite is essential. Strive for a minimum of 20 chews with each bite. This aids in the breakdown of food, facilitating a smoother process for your digestive system. This approach enhances digestion while fostering a sense of fullness, ensuring you feel content and satisfied without the need to overindulge. 3. Incorporate an abundance of vegetables and fruits into your meals while reducing your intake of white carbohydrates. A diet filled with vibrant greens and fresh produce is crucial for supporting gut health. These foods are rich in fiber, vitamins, and minerals that promote digestion and enhance overall health. Rather than choosing refined carbohydrates such as white rice and white bread, consider whole grains like brown rice, oatmeal, or quinoa. These intricate carbohydrates assist in stabilizing blood sugar levels, enhancing feelings of fullness, and aiding in weight management. One of my patients, Emma, aged 57, has faced challenges with bloating and constipation for many years. With a few straightforward adjustments to her meals, such as replacing white rice with brown rice and incorporating a greater variety of vegetables and fruits, she experienced a significant enhancement in her digestion. She now feels a sense of relief and enjoys a more effortless digestion, free from the discomfort she previously endured. 4. Select your post-meal beverages with care. The beverages you opt for after dining can greatly influence your digestive process. Should you experience a sense of bloating or heaviness post-meal, consider enjoying a warm cup of ginger tea or barley tea. These comforting drinks can ease your digestive system and relieve discomfort. Michael, a 66-year-old patient of mine, previously dealt with stomach discomfort and bloating following meals. He experimented with different solutions, yet nothing appeared effective until he began sipping barley tea after meals. The contrast was striking. Michael experienced a sense of ease as his stomach trouble subsided, leading to a notable enhancement in his digestion. Steer clear of cold beverages such as ice water, sodas, or alcohol immediately after a meal. These drinks can weigh heavily on the stomach and liver, interfering with the digestive process. Opt for soothing, comforting teas that enhance digestion and assist your body in processing food more effectively. 5. Administer medications with precision. If you are on medications for conditions such as high blood pressure, diabetes, or heart disease, the timing of your doses is essential. Some medications are best taken prior to meals, whereas others are more effectively absorbed when consumed 30 minutes post-eating. One of my patients, Patricia, who is 60 years old, inadvertently took her blood pressure medication immediately after her meal. Regrettably, this led to a rapid drop in her blood pressure, resulting in her fainting. During the course of events, she sustained a fracture in her hip. The issue arose as the blood circulation to her digestive system redirected blood from other areas of her body, such as her heart and brain. This highlights the significance of adhering to your physician's guidance regarding the correct timing of your medication. Seasonal and lifestyle precautions. If you're still engaged with this video and find these insights valuable, I'd love to hear from you in the comments below to know you're still with me on this journey. While we frequently concentrate on our dietary choices to enhance our well-being, it's equally important to consider how we care for ourselves after meals, adapting our routines to the changing seasons and our living environments. Throughout my experience, I've observed numerous seniors being admitted to the hospital due to neglected elements such as chilly drafts, abrupt hot baths, or the absence of assistance after meals. These seemingly innocuous scenarios can pose risks, particularly as we grow older. Let's delve into how to transform post-meal time into a health-enhancing experience, customized to the season and your unique living circumstances. Summer brings a warning about cooling shock. In the sweltering heat, many individuals seek relief through air conditioning after meals, rely on fans for a direct breeze, or indulge in icy drinks. Although these actions may provide immediate satisfaction, they can pose significant risks, especially for older adults. There was a patient named William, aged 68, who found pleasure in unwinding in his air-conditioned room following dinner. However, one evening, after completing his meal, he erred by positioning himself directly beneath the air conditioning unit. Not long after, he started to feel intense abdominal pain, accompanied by diarrhea and a significant drop in blood pressure, necessitating an urgent trip to the hospital. A cardiologist later clarified that a sudden encounter with cold air post-meal can startle the body, interrupting circulation and leading to various symptoms. The digestive system relies on a steady flow of blood to effectively process food, and sudden shifts in temperature can disrupt this essential function, adding unnecessary strain on your body. Avoid directing fans straight at your body. Instead, allow the air to flow softly to prevent a jarring difference between the coolness of the air and your body warmth. Choose beverages that are at room temperature or warm, like barley tea or gentle ginger tea, to aid digestion and regulate body temperature. During winter, it's best to refrain from going outside immediately after a meal. In the chilly winter months, it's common for individuals to venture outside right after a meal, whether to run errands or enjoy a brief stroll. Nonetheless, this may result in significant dangers such as elevated blood pressure, feelings of dizziness, or potentially fainting. I've encountered individuals who hurried outdoors after eating, only to faint due to their bodies not being ready for the sudden shift in temperature. The body requires a period to acclimate and effectively process food prior to encountering significant changes in temperature. During the winter months, the chill can constrict your blood vessels, heightening the risk of dizziness or fainting after a meal. It is advisable to remain indoors for a minimum of 30 minutes post-meal to maintain warmth in your body and facilitate the stabilization of digestion. In this season, consider enjoying a soothing cup of ginger or cinnamon tea to bring some warmth to your day. When stepping outside, take your time and let your body acclimate to the chill in the air. Exercise caution while dining out or attending events. When participating in social gatherings such as weddings, funerals, or enjoying meals at restaurants, it's typical to indulge in more decadent and sumptuous dishes. Although these meals can be quite delightful, they may impose considerable stress on your stomach and digestive system. I've observed numerous older adults facing challenges with bloating, heartburn, reflux, and even elevated blood pressure following these indulgent meals. One of my patients, Linda, expressed that after attending a wedding, she felt an intense discomfort from the rich food she had indulged in. She felt bloated and had heartburn, leading her to wish she had been more mindful of her digestion after eating. After enjoying a substantial meal, it's best to avoid lying down immediately. Rather, consider taking a leisurely stroll or softly shifting about before settling down to relax. This aids the body in processing food with greater efficiency. Always have your essential medications on hand and adhere to your schedule to avoid any health complications associated with your condition. For individuals living independently, it's important to be aware of potential health risks after meals. Seniors who reside alone may face heightened vulnerability to health complications following their dining experiences. Some individuals may feel lightheaded, experience discomfort in the chest, or have difficulty breathing following a meal. However, their solitude prevents them from seeking assistance promptly, resulting in perilous circumstances. Nancy, a 67-year-old patient of mine, had been experiencing dizziness following meals for several months. However, there came a day when the intensity reached a point where she felt utterly immobilized. Thankfully, she had the presence of mind to remain on the line with her daughter, who was quick to summon assistance. Consider making it a routine to connect with a friend or family member for 10 to 15 minutes after your meal if you live alone. This will not only soothe your thoughts but also guarantee that someone is mindful of your situation. Ensure your phone is close at hand and fully charged, allowing you to reach out for assistance if necessary. I trust that today's video was enlightening and provided valuable insights. The practices you embrace post-meal can greatly influence your well-being and lifespan, particularly as you grow older. By maintaining an upright posture and steering clear of strenuous workouts or extreme temperature shifts, these straightforward adjustments can significantly enhance your daily well-being. What insights have you gained up to this point? What practice will you begin incorporating into your routine after meals to enhance your well-being? Share your thoughts below and tell me one insight you've gained today that you'll incorporate into your daily life. If you found this video useful, please take a moment to share your thoughts in the comments, give it a thumbs up, and pass it along to friends or family who could gain from it. Don't forget to subscribe to our YouTube channel and tap the notification bell to ensure you stay updated with essential insights for a healthier, happier life. I appreciate your time, and I look forward to our next encounter in the upcoming video.